If there's one idea worth carrying with you after this conversation, it's this. The brain is not a dictator. It's a responder. It listens to signals from the body, from the gut, the immune system, metabolism, sleep, and stress, and then it adjusts. That means you are not powerless, even when change feels slow, even when the future feels uncertain, even when family history weighs heavily. You don't need to overhaul your life. You don't need to follow a perfect plan. You only need to begin with one small, realistic choice. One meal that's a little less processed. One extra plant food on your plate. One gentler rhythm between dinner and breakfast. These choices don't look dramatic, but biology doesn't respond to drama. It responds to consistency. When the signals become quieter, the brain often follows, with more steadiness, more clarity, and more resilience over time. This isn't about controlling the brain. It's about supporting the system it depends on. And that's something you can do. Not all at once, not perfectly, but steadily. So if you're wondering where to start here, at your next meal, with one thoughtful choice. And the understanding that small changes, repeated calmly, are often the ones that last the longest. That's not false hope. That's informed confidence. And it's more than enough to begin. Understanding inflammation, the 4 simple dials. Before we talk about painkillers, supplements, or food, it helps to understand one simple idea. Pain and inflammation are not random. They're controlled by a few key dials inside the body. Think of your body like a house with a fire safety system. When something goes wrong, the alarms come on. That's inflammation. The problem isn't the alarm. It's when the system doesn't switch off properly. There are 4 main dials involved. 1, the pain factory. This is the system that produces pain signals and swelling. When this dial is turned up, you feel soreness, stiffness, heat, and discomfort. Most common painkillers focus almost entirely here. Turn the dial down, pain eases, simple but temporary. 2, the master inflammation switch. This one is bigger. When it's flipped on, it doesn't just create pain. It activates hundreds of inflammatory responses at once. Think of it like the main circuit breaker for inflammation. If this switch stays on, the body keeps reacting even when the original problem has passed. 3, the inflammation megaphone. This dial doesn't start inflammation. It amplifies it. Imagine someone holding a megaphone next to the alarm, making everything louder and longer than necessary. This is why inflammation can drag on for weeks or months. Many long-term inflammatory conditions are linked to this system, being too loud for too long. 4, the backup alarm. This is the system that keeps ringing after the fire is already out. Even when the first 3 dials are turned down, this one can keep inflammation simmering quietly in the background. It's often involved in chronic, recurring inflammation. Here's the key takeaway. And this is where clarity replaces fear. Most treatments only turn one dial down. True inflammation relief comes from calming the whole system, not silencing one alarm. Once you see inflammation this way, it stops feeling mysterious or overwhelming. It becomes understandable, manageable, and something you can influence, gently, step by step. Now that we understand the system, let's look at how common pain relievers actually work and where they fall short. How common pain relievers really work now that the 4 inflammation dials are clear, common pain medications start to make a lot more sense. Let's look at them calmly, without judgment. Ibuprofen. Ibuprofen is fast and effective. It works mainly by turning down the pain factory dial, which is why relief can come quickly. But that same pathway also helps protect the stomach lining and support kidney function. When it's switched off too often or for too long, side effects can show up. Not because the drug is bad, but because it's doing exactly what it's designed to do. Ibuprofen is helpful. It's just not designed for long-term system balance. Aspirin focuses on a single inflammatory pathway. For some people, that's enough. For others, especially with ongoing inflammation, it doesn't address the bigger picture. And because it affects stomach protection, it can increase the risk of irritation or bleeding over time. Again, useful but targeted. Tylenol, paracetamol. Tylenol works differently. It doesn't reduce inflammation much at all. Instead, it dulls pain perception in the brain. That's why pain feels quieter, even though the inflammatory process underneath may still be active. This can be helpful short-term, but it explains why inflammation often returns unchanged. So why do people keep needing more? Because most pain relievers turn down one dial, work temporarily, don't address why the system keeps switching itself back on. That's not a failure of medicine. It's simply a limitation of what these tools are meant to do. The important shift is this. Medication can calm pain. Understanding inflammation helps prevent it from returning. Once that distinction is clear, fear drops away, and better decisions become easier. Not rushed, not reactive. Next, we'll look at why certain natural compounds work differently, and how they fit into this system without forcing it. Curcumin, why this one works differently. Now here's where the conversation shifts. From symptom control to system support, curcumin doesn't rely on just one pathway. It works by gently turning down several inflammation dials at the same time. The pain factory, the master switch, and the amplifier. Not forcefully, not abruptly, but steadily. That's an important difference. Instead of silencing one alarm, curcumin helps calm the entire inflammatory environment. This is why its effects may feel less dramatic at first, but more balanced over time. Why black pepper matters. On its own, curcumin is poorly absorbed. Most of it simply passes through the body unused. That's where black pepper extract comes in. A compound in black pepper dramatically improves curcumin absorption by many times. Without it, even high doses may not do much at all. With it, the body can actually use what's taken in. This is one reason so many people say turmeric didn't work for them. They never absorbed it properly. What the research shows, this isn't folk wisdom or tradition alone. A well-designed, randomized, double-blind, controlled study followed 367 people and compared 1,500 mg of concentrated curcumin with black pepper, standard doses of ibuprofen. The results showed comparable improvements in pain and inflammation, but with significantly fewer side effects reported in the curcumin group. Importantly, this research was done on humans, not animals, and it was peer-reviewed. Effectiveness versus tolerance. Here's the calm, balanced takeaway. Ibuprofen works fast, but can stress protective systems when used often. Curcumin works more broadly, without switching those systems off. This doesn't make curcumin a replacement for medication. It makes it a different kind of tool. One that supports the body instead of overriding it. And once that distinction is clear, something shifts emotionally. Less urgency, more confidence, and a sense that inflammation isn't something to fight, but something to understand and calm. Next, we'll look at other natural compounds that support specific inflammation dials and how they fit into the bigger picture. Other natural supports that calm inflammation. One of the most reassuring things to understand about inflammation is this: the body doesn't rely on just one solution, and neither do you. Curcumin isn't standing alone. There are several natural compounds, each supporting a different part of the inflammation system. That's good news. Extra virgin olive oil. True extra virgin olive oil contains natural compounds that gently influence the same pain-related pathways targeted by some medications, just far more subtly. That slight peppery sensation you feel at the back of the throat, that's not a flaw. It's a sign those compounds are active. Used regularly, olive oil doesn't shut things down. It helps keep inflammation quieter in the background. Ginger is often underestimated. Rather than targeting pain directly, it helps turn down the inflammation amplifier, the system that keeps inflammation lingering and louder than it needs to be. That's why ginger has traditionally felt warming and settling, especially in the joints and digestion. Omega-3 fatty acids. Omega-3s found in fish oil and cod liver oil help rebalance inflammatory signals, especially when modern diets contain too many inflammatory fats. They don't mask symptoms, they help restore proportion. Boswellia works on the backup inflammation alarm, the one that keeps ringing long after the original issue has passed. This makes it particularly useful for stubborn, recurring inflammation that doesn't fully settle. Immune-supporting nutrients, compounds that support immune balance, often used in autoimmune conditions, help reduce the megaphone effect of inflammation. They don't suppress immunity, they calm overreaction. The important emotional shift here is this: you're not dependent on one pill. You're not locked into one strategy. You have options. Layered, flexible, and adaptable. And that sense of choice alone often brings relief before anything else changes. Next, we'll look at something even more important than supplements. What actually turns inflammation on in the first place? The big shift, what really turns inflammation on. Up to this point, we've talked about how inflammation works and how different tools can calm it down. Now comes the part that quietly changes everything. The most important question isn't, how do we turn inflammation off? It's, what keeps turning it on in the first place? Because when you see that clearly, inflammation stops feeling like bad luck and starts making sense. There are 5 main drivers behind long-term, ongoing inflammation. And here's the key point: every one of them can activate all 4 inflammation dials at once. 1. Insulin resistance. This is the most common and most overlooked. When the body is exposed to frequent carbohydrates, sugars, constant snacking, and certain industrial oils over time, cells stop responding properly to insulin. The result isn't just blood sugar issues. It's a constant low-level inflammatory signal throughout the body. This alone can keep all 4 dials turned up, quietly, persistently. 2. Mitochondrial strain. Mitochondria are your cell's energy centers. They're affected by poor sleep, overtraining, long-term stress, ultra-processed food, smoking or toxins, too little movement, or too much, without recovery. When energy production falters, the body interprets it as danger. Inflammation switches on as a protective response. 3. Chronic oxidative stress. This is wear and tear that never quite gets repaired. Alcohol, smoking, pollution, processed food, and ongoing stress all contribute. Over time, the body stays in defensive mode. Inflammation becomes the background noise. 4. Gut barrier disruption. When the gut lining is irritated, often by ultra-processed foods, certain grains or inflammatory oils, substances that shouldn't enter the bloodstream slip through. The immune system reacts. Not aggressively, constantly. This alone can keep the master inflammation switch flipped on. 5. Chronic infections plus stress. Some viruses and infections don't fully leave the body, they go quiet. But under chronic stress, they can reactivate. Just enough to keep the immune system alert and inflammatory signals active. This isn't rare. It's common, the quiet realization. Here's where the emotional shift happens. None of these causes are sudden. None are dramatic. They're lifestyle patterns, repeated gently, daily, over years. And for many people, reading this sparks a calm recognition. This isn't random. This didn't come out of nowhere. I can see where I fit. That moment isn't heavy. It's grounding. Because once the cause is visible, the body stops feeling broken and starts feeling understandable. And that's where real change begins. Not with fear, but with clarity. Next, we'll look at what actually helps reverse these drivers in a way that's realistic, sustainable, and gentle on the body. The core solution: food and eating rhythm. Once the real drivers of inflammation are clear, the next step becomes much simpler than most people expect. Not dramatic, not complicated, just aligned with how the body is designed to work. Low carb, keto style, eating, reducing excess carbohydrates helps lower insulin demand. When insulin resistance eases, one of the strongest inflammation triggers begins to quiet down. This isn't about strict rules or perfection. It's about giving the body fewer signals to stay inflamed. Removing ultra-processed foods. Ultra-processed foods don't just lack nutrients. They actively disrupt energy production, gut integrity, and immune balance. Removing them isn't deprivation. It's removing constant irritation. Many people notice inflammation softening simply by eating real, recognizable foods again. Intermittent fasting. This is one of the most powerful and overlooked anti-inflammatory tools. Spacing meals allows insulin to settle, mitochondria to recover, and inflammatory signals to calm. For many, joint stiffness and swelling ease noticeably when the body gets regular breaks from digestion. Importantly, this isn't about hunger. It's about rhythm, prolonged fasting, with guidance. In more stubborn, inflammatory, or autoimmune cases, carefully supervised longer fasting periods can further reset inflammatory pathways. This is not for everyone, and not something to rush. But when done correctly, it can allow deep repair processes to engage, supporting nutrients. Certain deficiencies quietly maintain inflammation. Magnesium for muscle and nerve. Calm, vitamin D for immune regulation. Zinc for repair and balance. Omega-3s to counter inflammatory fats. Restoring these doesn't force the body. It supports it. The emotional shift. Here's what matters most. There is a clear path. Nothing here is mysterious. Nothing requires panic or extremes. Inflammation responds when the body feels safe, supported, and no longer overloaded. And once that direction is clear, the process stops feeling overwhelming and starts feeling doable. Next, we'll gently bring everything together so it feels complete, not endless. Medication can quiet pain, and sometimes it's necessary. But it isn't the root solution. Inflammation isn't a life sentence. It's a signal shaped by daily inputs over time. When those inputs change, the signal changes too. Nothing here requires urgency or fear, just awareness, small adjustments, and consistency. The most important shift is this: your body isn't failing you. It's responding. And you have more influence than you were ever told. That's where real, lasting change begins.